Hello everyone, my name is Dr. Niharika. I'm working as a fertility consultant in Kamineni Fertility Center, Koti branch. Today's topic is about adenomyosis and how is it going to affect the fertility or causing infertility. The coming month, April, is known as the Adenomyosis Awareness Month. So on this occasion, I would like to explain you what is adenomyosis and how does it affect the fertility. The term adenomyosis is defined when the presence of the ectopic endometrial tissue, meaning we know that the endometrial tissue is present in the endometrial cavity of the uterus, but sometimes due to some theories like the injury to the endometrial lining or metaplastic changes in the myometrial cells cause the change of the myometrial few of the myometrial cells into the endometrial cells. That is, the presence of the endometrial glands and stroma is seen within the myometrium. So presence of this tissue causes the hyperplastic and hypertrophic changes in the surrounding myometrium and cause the changes called as adenomyotic changes and lead to the presence of myometrial cysts within the myometrium. So, and also because these are the endometrial glands, they are responsive to the regular hormones or the endometrial lining, which is also responsive to the hormones in the menstrual cycle. So whenever there is shedding of the endometrium in the first 5 days of the menstrual cycle, there is also shedding of the endometrial cells in this ectopic tissue that is present in the myometrium, which causes collection of the blood in the myometrial tissue, and this is the major reason why the patients suffer from dysmenorrhea, also called as severe menstrual pain during their periods. So this pent up secretions of the blood in the myometrial cyst or the myometrium at places where the ectopic tissue of the endometrium is seen will lead to the increase in the size of the uterus, and also the main reason why the patients present with the abnormal uterine bleeding in the age group of 30 to 40 years of age. So this is called as adenomyosis. So now that we've understood what adenomyosis is, we also have to understand why it causes infertility. So in adenomyosis, because of the changes, inflammatory changes that are happening in the myometrium because of the endometrial glands being present in the abnormal location than the normal location, there occurs an immunological reaction that happens. There is an inflammatory reaction because of which there is increased release of the hormones like P450 cytokine activity, estrogen and prostaglandins are increased in their number, and these could be the reasons to cause the hyperperistalsis of the myometrium. Myometrium has got some amount of peristaltic movement and it is in a synchronized manner that happens normally, but because of this myometrial tissue undergoing inflammation because of the endometrial glands, there is hyperperistalsis of the myometrium on that side of the uterus. This adenomyosis is localized mostly to the posterior wall of the uterus, and sometimes it can be even diffuse, occupying the entire myometrium, anterior and the posterior wall of the uterus. So this causes abnormal or the hyperperistalsis of the uterus, which leads to the abnormal sperm transportation from the uterus into that of the fallopian tube, and hence it might hamper the fertilization of the sperm with the egg. And also it causes increased dysregulation of the genes that are helping the embryo to get implanted within the endometrial cavity. It decreases the implantation markers that are necessary for the embryo to get implanted, and therefore it can decrease the chances of fertility. Also, sometimes because of this hyperperistalsis, even though the embryo has got implanted, it can increase the chances of miscarriage in the first trimester of pregnancy. So this is the probable reasons why the infertility is being seen in patients with adenomyosis. Now, adenomyosis in earlier days, like about 10 to 15 years ago, it was very rare disease that used to be identified, and the incidence of adenomyosis was very less, and it is mostly seen in patients who were above 35 or 40 years of age, and hence it was used to be called as the disease of the elderly. But today, in the incidence of adenomyosis around 19% in the reproductive age group, and to be precise, it is around 22% in the age group of infertile patients between 30 to 40 years of age. So the incidence of adenomyosis is somehow increased over the last decade, and also it could be the reason why we see more number of cases. The increased incidence could also be because of the increased diagnostic modalities that are being used for the diagnosis of adenomyosis, because initially there used to be less diagnostic modalities, and hence the diagnosis was not very proper. But now with the improved diagnostic modalities of ultrasound, 3D ultrasound, the MRI, hysteroscopy, laparoscopy, or the histopathological examination or the ultrasound guided biopsy of the myometrium help us to diagnose the adenomyosis easily. The most common and sensitive diagnostic modalities are the 2D or 3D ultrasound of the pelvis and the MRI. So these are the two modalities that have helped or increased the diagnosis of adenomyosis over a period of time. So as I said, we also have to understand how the adenomyosis is causing the difficulty in the infertility. As I said, because of the abnormal uterine contractions, or the hyperperistaltic movement, sometimes the embryo might not get implanted properly, or the sperm and the egg approximation might not be proper in the fallopian tube, and hence leading to infertility. So what could be done to decrease or improve the chances of implantation, or improve the chances that the patient can conceive? So whenever we diagnose a patient with the infertility, we first have to analyze the couple as a whole, meaning rule out the other factors of the infertility like ovulatory factors, tubal factors, or the male factor. And if the patient is of a young age group between 30 to 35 years of age, and the ovarian reserve is in the normal range, tubal patency is normal, and the semen parameters are normal. So in those patients, less treatment modalities like the ovulation induction or the intrauterine insemination can be attempted depending upon the fertility index of the couple. But if a patient is more than 35 years of age, poor ovarian reserve is seen, or there are male factors, or the patient is a candidate for the in vitro fertilization or the ICSI process, then we usually follow the what is called as ultra long protocol, wherein we give the hormonal injections called as GnRH, that is gonadotropin releasing hormone agonist, to suppress the hormonal or the imbalances that we see in the myometrium or these ectopic endometrial glands or tissues that are present in the myometrium, to suppress them so that they don't produce any hormones or cause inflammation, and also to increase the implantation markers in the endometrium, which increases chances of implantation. So we give the patient, we first do the ICSI process, that meaning the give injections and retrieve the oocytes and prepare the embryos and freeze them, then go for the injections, which we usually give for a period of 3 to 6 months. And after giving the injections and ascertaining that the hormonal changes have come down or the hormonal imbalance is reduced, then we go for the frozen embryo transfer and do the embryo transfer. Various studies have also shown that doing the ultra long protocol has increased chances of implantation and the pregnancy rates by about 45%. So hence the ultra long protocol for the adenomyosis is a best protocol that we can do as of now to increase the chances of pregnancy and the live birth rate.